Thank you for coming to our goal setting training this morning. We appreciate your time. We are going to try to very quickly just go through a little bit of what the expectations are for the Emerge initiative and specifically concentrate this morning on the department goal setting piece of the initiative. So for those areas in which there is a faculty member that reports directly to the dean, part of the one-on-one review meetings this year with chairs and others was a continuation of the process that the dean started last year, where he asked individuals to set goals both individually for themselves as well as for their department and their areas. So if you work in one of those departments in which that is true, the very first thing I'm going to say is to go back, talk with your faculty leader to find out what sort of goals they may have established or may have already submitted to the dean. I'm working with the dean's office to go through and look at what's already been established. For those of us for which that's not the case, we're a little bit more on our own, a little bit more independent in terms of saying, you know, what are some of the goals that we may want to set for our area. So the goal of the Emerge system is that everyone from July 1st to October 31st would take time to set an individual goal, and that those goals would be aligned with department goals, and that the department goals would be aligned with the institutional goals. So we want to make sure that we're all in a good spot to be able to determine what those department level goals should be. So we're going to go through the value of goal setting, talk about different areas specific to each of our areas of focus that we might be able to set a goal for, figure out how to do an effective and actionable department goal, and then to identify where we're going to go from there after our goals are set. And we're going to accomplish all of that in a little less than an hour. So strap on your seatbelts, here we go. So the importance of department goal setting, to some degree this goes without saying, but for us here at MCW, again, much like the performance review process, I think departmentally we've all been at different places in the journey as to whether or not we've been setting goals as a department and communicating that out and letting everybody know about it, or whether or not it's just been more of an individual process, employee by employee. So back in February, the president rolled out for us at the town hall the institutional goals that we have, and that's really the first time in at least a very long time that MCW has really had kind of a compass, if you will, in terms of where are we going organizationally, institutionally, what direction are we saying we're moving in. So now that we have those institutional goals, we realize that it's really important that as departments, we take a look at where are we going and how does that direction line up with the direction of where the institution is going. So in other words, in each of our specific areas of focus, what are we doing that best supports where the organization says that it's going? And so that's where we as leaders come in our areas to really be able to say where are we going as a department, and then help to educate our faculty and staff about where that direction is and how that aligns with where the organization is going overall. I've said this in many conversations that I've had with some of you in the room and others, that the resounding theme from both the Faculty Forward and the Staff Insight Survey was, I don't understand how my contribution and or the contribution of my department lines up to the contribution of the institution as a whole. So I love working at MCW, I love what I'm doing, but I don't understand how I'm moving the institution forward. And so that's really was kind of the birthplace of this Emerge initiative, and one of the big things that we really want to be focusing on. So for those of you for which setting department goals are somewhat new, we're really recommending that you start by doing somewhat of a SWOT analysis, taking a look at what's going well in the department, what are some areas in which we need to do better, and each of you will have different metrics, different pieces of data that you will use to determine what's going well, what isn't going well, what opportunities present themselves, particularly as we look at the institutional goals and the direction that's going. When you look at what it is you do in your area, what opportunities are there to support those institutional goals, and then, you know, what are some of the threats that exist. So for those of us that are in clinical and basic science departments, we could probably do this real easily in about the next 5 minutes. We're all pretty familiar with what some of the opportunities and threats are. For those of us that are in more central administrative areas, I think really taking a look at what are the overall opportunities and threats to the organization as a whole. So reduced funding, market share in the clinical area, and how do we as central administrative areas best support where the organization is going, and how can we help our customers that we serve. So I think coming together with leadership in your department to do a SWOT analysis can help bring you to the place of what some of your department goals should be. We also would suggest getting employee input, so pulling your staff together and maybe doing this SWOT analysis, taking 45 minutes to an hour, doing a SWOT analysis as a group and saying, okay, you know, what are some of the things that we really need to be thinking about, and hearing from your employees. You know, one of the other things that we heard loud and clear in the engagement surveys was we want to have more dialogue. We want to have more input with our leaders. So I think even in the department goal setting process, this can be an opportunity to really pull the group together and engage in dialogue. And then finally, if you feel that this might be more apropos to your area, we certainly have a lot of retreating that we do. And I mean that in the positive sense, not the running away. So you may want to hold a retreat with the leaders within your area, and again, do a real deep dive into where have we been and where do you think we should be going, understanding the current climate. And you know, remember that the ultimate objective of all of this is really to come out with 1 to maybe 3 department goals. You know, we're going to suggest that you really shouldn't have more than 3 goals. We're asking for a minimum of 1, but it's awfully difficult to concentrate and really sort of move the needle on anything when you have, you know, 10, 15 goals. So we have some very eager folks here at the college that have been setting a lot of goals. So I'm just going to advise that you probably want to do 1 to 3, concentrate on some big areas, and do those well. So other things to consider as you begin to look at this whole goal setting process. We've talked a little bit about this in terms of the SWOT analysis, but these may be some actual questions that you'd want to put in front of your employees or your leaders as you sit down and sort of do this. You know, where is the department heading? What results are we achieving currently? This really goes to, you know, what are we doing well? And what are some of the metrics or those pieces of data that you might want to pull together to really take a look at that? Where do we want to improve? And what is actually attainable with the available resources? So one of the things that we're talking about as we look at the training around the individual goal setting, we've been talking about making them simple. Okay, simple goals. And what that really means is, you know, measurable, important, realistic. We know that we are all, no matter what area we are in an environment in which resources are tight. That is an environment that is not likely to change anytime soon. So as we take a look at where are we heading, what do we want to accomplish, really making sure that we can accomplish these with the resources that we know are going to be on the horizon, I think will be really important. Okay? So some areas that you may want to take a look at: projects, quality, service, enhancing efficiencies. We've had, quite a few lean efforts going on. I just met with the MCP practice yesterday, and they're actually putting a lean team together that's going to go out to departments and to areas to really help them address clinical efficiencies. So that may be something that you'd want to take a look at. Fiscal performance, employee engagement. A lot of us put action plans together after we did the faculty forward and staff insight surveys. It could be that there's something on that action plan that you're really going to set as your department goal for this year. You really want to enhance employee engagement in a certain area. That would be a great goal. Many of you have already been working on things over the last year, so it may be just taking one of those items and refining them or taking it to a next level, and that's going to be your department goal. Could be some things around workforce planning as well. What types of talent do you need? What types of services do you need to be providing? And what would that look like? How would that change the way that your area is constructed? So a couple of different types of goals. I think this is something to think about not only as you're looking at developing your own department goals, but as you sit down and begin to work with your employees around their individual goals. We talk about two different kinds of goals: stretch goals, opportunity goals. We're really going to be encouraging departments to look at stretch goals, things that kind of cause us to go a little bit above and beyond, things that get us out of our comfort zone a little bit. I think the old saying about human nature is really true, that we tend to rise to whatever level is expected of us. And so we're really hoping that through this department goal setting process, we're going to be setting goals that will help all of us rise to a new level. So aggressive but achievable. And I think if there was one thing that you sort of walked out of here today with in terms of the theme of the department goal setting, is we want to set aggressive goals that we can actually achieve, okay, within the framework of some of those things we talked about the slides earlier. And then opportunity goals, again, talking about, where are some areas we could improve. All of us have, or I should say most of us have, metrics, things that we measure ourselves, benchmark ourselves against in terms of how we're doing. I think those can be a really great place to take a look at what we need to be doing. And then those that might be recommended for essential areas. So what are some of the core functions, fundamental pieces that we're responsible for in our area, and are those things going well, or are there goals that we need to set to try to make those a little bit better, enhance those a little bit? So as I look at some of the areas that I'm responsible for, in human resources, we do a customer service survey. We also do one in the Office of Faculty Affairs. We also have customer service standards that we've set in terms of turnaround, and we track all of that. So as we look at setting department goals, those would be some of the metrics that we're pulling together to say, how are we really doing? And are there adjustments that we need to make in that? We've also put together a document that really goes through kind of the major initiatives at the college that we're responsible for. And we're taking a look at all of those projects and coming up with, what are some of the themes from that? And then looking at setting goals from that. In our particular instance, we're looking at setting goals based on the roles that people play within the department. So if I were to take something like, let's say, the Zoo Interchange project, and how we think that might affect the recruitment of employees to the medical college over the next 5 years. My guess is that there are going to be some very specific sort of market-sensitive jobs where I could go to any healthcare system that people may say, I don't think I want to put up with the Zoo Interchange madness over the next 5 years, so I'm going to, go look someplace else. So I may have goals set for my recruiters that are going to be around that project. They're all going to have the same goal, and we're all all going to be focusing on the ability to continue to attract top-level talent in the midst of that threat that we have coming before us. I might be in a clinical area and I would really want to be focusing on time to next appointment because we have an issue there, and everyone in my department can impact time to next appointment. So I set a department goal and we're all going to focus on that for the next year. Our critical thing is going to be to try to get our time to next appointment down to 30 days or down to 2 weeks or something along those lines, okay? So I think as we approach this, the more that you can be thinking about department goals in which everyone has a piece that can contribute, the easier it is going to be for people to really kind of resonate and figure out how they align to that goal. You may find that as you take a look at it, you're going to have a particular focus or goal for faculty and maybe a particular focus and goal for your staff based on how they contribute. But I think the most important piece of what you can do in all of this is really sort of that SWOT analysis and that dialogue to say, where are we headed? And what do we really want to focus on over the next year? What is something that the individuals in my area can really, grab a hold of and say, this is where we're going, this is what we're focusing on? And what are those 1 to 2, 3 things that we might be able to do?